The Drug Enforcement Administration, or DEA, has issued a stark warning. Fentanyl is the most serious drug threat facing our nation today. This synthetic opioid is not only highly addictive, but also incredibly potent, posing a severe risk to anyone who comes into contact with it. This synthetic opioid is highly addictive and incredibly potent, making it a grave danger to public health. Even a small amount can lead to overdose and death, highlighting the critical need for awareness and prevention. The DEA's assessment underscores the urgency of addressing this crisis and protecting communities from the devastating effects of fentanyl. They emphasize the importance of education and community involvement in combating this epidemic. The widespread availability of fentanyl, often laced into other drugs, has led to a surge in overdoses and deaths across the country. This alarming trend has affected countless families and communities, leaving a trail of heartbreak and loss. The DEA is committed to working with local, state, and federal partners to disrupt the trafficking of this deadly substance. Through coordinated efforts, they aim to reduce the supply and demand, ultimately saving lives and restoring hope to affected communities. Fentanyl is a synthetic opioid, meaning it is a man-made drug that acts on the same receptors in the brain as natural opioids like morphine and heroin. It was developed for medical purposes, primarily for pain management in hospital settings. Fentanyl is a very effective painkiller, often used for severe pain relief after surgery or for individuals with chronic pain conditions like cancer. However, the same properties that make fentanyl effective for medical use also make it highly dangerous when misused. It's significantly more potent than heroin or morphine, meaning even a very small amount can be lethal. One of the most alarming aspects of fentanyl is its potency. It is estimated to be 50 times stronger than heroin and 100 times stronger than morphine. This incredible potency makes fentanyl extremely dangerous, as even a tiny amount, equivalent to a few grains of salt, can be fatal. Because fentanyl is often mixed with other drugs or pressed into counterfeit pills, individuals may unknowingly ingest a lethal dose. The DEA has issued warnings about counterfeit pills made to look like prescription opioids like OxyContin or Xanax, but containing fentanyl. Section 4, Fentanyl's Grip on Utah, a Local Perspective. The fentanyl crisis has reached every corner of the United States, and Utah is no exception. According to KSL News, fentanyl-related overdoses have been steadily rising in the state. In 2023, Utah reported over X fentanyl-related deaths, a stark reminder of the lethal nature of this drug, highlighting the devastating impact of this drug on local communities. Families are torn apart, and the social fabric is strained. Law enforcement agencies in Utah are actively working to combat the flow of fentanyl into the state. They're employing new strategies and technologies. KSL News recently reported on a major drug bust that resulted in the seizure of a significant amount of fentanyl, enough to save countless lives, demonstrating the commitment of local authorities to addressing this crisis. Community leaders are also stepping up, advocating for better prevention and treatment programs. Section 5. Combating the crisis and efforts to stem the tide. Combating the fentanyl crisis requires a multifaceted approach involving law enforcement, public health initiatives, and community outreach. Each of these elements plays a critical role in addressing the issue from different angles. The DEA has made disrupting the trafficking of fentanyl a top priority, working tirelessly to dismantle drug trafficking organizations and intercept fentanyl shipments before they reach communities. In addition to law enforcement efforts, there is a growing need for public awareness campaigns to educate people about the dangers of fentanyl. These campaigns aim to inform the public about the severe consequences of fentanyl use and how to avoid it. Providing information about the risks of counterfeit pills, the signs of overdose, and the availability of naloxone, a medication that can reverse opioid overdoses, is crucial in saving lives. Training sessions and educational materials are essential tools in this fight, empowering individuals to act swiftly in emergency situations. Section 6. Staying informed, saving lives, a call to action. The fentanyl crisis is an urgent public health emergency that demands our attention and action. By understanding the dangers of fentanyl, recognizing the signs of overdose, and supporting efforts to combat its distribution, we can make a difference. If you or someone you know is struggling with opioid addiction, resources are available to help. Contact your local health department or substance abuse treatment center for support and information. Together we can work to prevent fentanyl overdoses and save lives.